Kaleida Health says a Medicaid burden will force them to sell a long-term care facility. Their outgoing president sent an email to employees saying HighPointe on Michigan has been bleeding money since it opened. Senior reporter Eileen Buckley got a copy of that email.
This email, titled "The Challenging Year Ahead," was sent by Kaleida CEO Jody LeMayo. LeMayo refers to the $2.5 billion in Medicaid cost cuts proposed by the governor for the upcoming state fiscal year. He stated that would create a 10% cut in Medicaid payments to every hospital and nursing facility in the state. The email says Kaleida's revenues are stagnant and talks about reducing expenses, including the possible sale of its long-term facility, HighPointe. And in this email that 7 Eyewitness News obtained, Kaleida says that HighPointe here on Michigan has lost $80 million since it opened in 2011. Kaleida's senior vice president, Michael Hughes, confirmed in an email to 7 Eyewitness News that Kaleida is looking to sell HighPointe. Hughes wrote, "Due to financial, legal, and risk issues, we are looking for a qualified operator to continue long-term care operations at that site, and that Kaleida has begun a process to identify a potential qualified operator." Potential Medicaid cuts from both the state and federal governments would be a major challenge in Erie County. County Executive Mark Polenkar says they must ensure there are enough beds for those in need of long-term care.
We certainly don't want to see nursing facilities close in our region because we need the beds. There are more people that need that extended long-term care or even temporary care in a facility like a nursing facility that they can't get elsewhere.
Polenkar says there are 50,000 more people in Erie County on Medicaid today than a decade ago. We tried to speak to those entering and leaving HighPointe. Employees declined to comment, but one staffer says the possible sale was the talk of the building. The union that represents Kaleida workers, CWA Local 1168, posted a video on its Facebook page last week after marching into Kaleida's executive offices to get answers. Hughes and another administrative leader listened to a more than 30-minute peaceful plea about patient safety. One staffer said plans for cutting a blood bank at Oshai Women and Children's Hospital is, quote, petrifying. In Buffalo, Eileen Buckley, 7 Eyewitness News.